Let's go through 10 facts about urinary tract infections. Do you think you'll know them all? Number 1. Holding in your urine for extended periods of time is strongly associated with developing a UTI. Think things like car rides, concerts, and unforgiving workplace environments. Not only are you letting bacteria fester longer than they need to in the bladder and cause local urinary symptoms, but you're also giving them the chance to ascend through the ureter and cause further infections upstream. Number 2. A UTI is not just a simple infection. Besides the urinary discomfort, many people, young and old, can spiral into sepsis due to a UTI or a more dangerous or invasive infection like pyelonephritis, infection of the kidney, or bacteremia, infection in the bloodstream. Not taking the proper medications from an urgent care or a doctor's office can seriously lead to these severe infections that require hospitalization and IV medications. Number 3. Men can get UTIs too. It's just more common in women due to anatomical differences, such as them having a shorter urethra and theirs being physically closer in proximity to the anus and its bacteria. Number 4. Cloudy or bad-smelling urine alone doesn't necessarily mean you have a UTI. And bacteria growing on a urine culture also doesn't necessarily mean you have a UTI either. While the urinary tract is supposed to be sterile, bacteria can find its way up without causing a true infection. In the absence of any symptoms like burning with urination, increased urge, or frequency, this finding is just called asymptomatic bacteriuria. Number 5. Because of rising antibiotic resistance, clinical guidelines actually do not recommend treating asymptomatic bacteriuria. There are a few exceptions to this though. Asymptomatic bacteriuria in a pregnancy is a big one. A patient undergoing a urologic procedure with mucosal bleeding risk like a prostate resection is another. Number 6. Not urinating after sexual intercourse doesn't mean you will get a UTI, but urinating after sexual intercourse doesn't magically eliminate your chance of getting a UTI. There is very underwhelming research regarding its efficacy in a normal population, but it is a helpful habit to maintain in people who do have a history of recurrent UTIs. Number 7. In those patients, medications do exist that can be used to lower the risk of a repeat UTI. We usually only offer these if the UTIs are truly recurrent and often correlated to sexual activity. These include antibiotics or non-antibiotic therapies like methanamine. Number 8. Bacterial vaginosis, BV, is not an STI or a UTI. BV describes overgrowth of bacteria that disrupts the normal vaginal flora, which then leads to symptoms like vaginal discharge, pain, and itching, which are common among STIs. This dysbiosis, however, can predispose you to developing a UTI on top of that. Bacteria that cause BV, like Gardnerella vaginalis, and bacteria that cause UTI, like E. coli or Klebsiella, are also usually treated with 2 separate classes of antibiotics. Number 9. Not all UTIs are bacterial. Candida albicans, a fungus, is also a common cause. As such, this one is treated with antifungals rather than antibiotics. Number 10. Certain kidney stones can increase the risk of a UTI because they block the outflow of urine, leading to renal or ureteral swelling and inflammation, giving bacteria a highway to travel up unimpeded. Certain UTIs can also increase the risk of kidney stones, such as Proteus mirabilis, which causes struvite stones in the kidney, as you can see by this thick boy called a staghorn calculus. Do you see the resemblance? Alright, how did you do? Did you know all 10? If you have any more fun facts about urinary tract infections, let me know in the comments.